Hello everybody, this is Dr. Ayaz Samo. Today we will be learning about human anatomy and physiology and teeth of the mouth. So, questions. Do you know if we can call teeth as a bone or not? Number second, do you know how at what age we lose our teeth when we are babies? And do you know the branch of dentistry which deals with the abnormally aligned teeth, deals with teeth correction? What is called the branch of dentistry? What is the name of that branch? Um, do you know what is the root canal therapy? And all these questions can be answered by knowing the structure and function of the teeth. So let's directly jump into the topic. Okay, so the objective of today's learning will be the identifying the parts of the typical tooth and compare um, it with deciduous and permanent dentitions. So deciduous and permanent, what is, we will also study what is the difference between deciduous and the permanent dentitions. All right, okay. So here, um, this is the structure, anatomy of the human dentist. So uh, if you look at this, you would find that the mouth is generally comprised of the three external regions. The first region is called, this is the first region, this is the second region, and this is the third region. So the first region is called crown. So this is the crown. It can be visualized by naked eye, and this is the neck, and this portion, this is the root of the dentist, right? And the teeth are also called dentist, and they are the accessory digestive organs of the gastrointestinal tract. All right, so you can see that these 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 teeth, these teeth or tooth is inside this structure. So this is called socket, right? Socket. And if you look at this socket, you will find different structures. So um, uh, this is the gum tissue, right? This is the gum tissue, and beside this gum tissue, this the muscles which aligns here is, these are called periodontal ligaments, and these periodontal ligaments are responsible for anchoring the tooth as a shock absorber, because when we chew the food, they provide certain shocks, and to absorb this shock, the structure which is responsible for shock absorption is called periodontal ligament, right? And inside this ligament, this is called these are the gums. You can see the gums. So gums are responsible for holding and holding the teeth, right? Okay, and then if you closely look at this structure, uh, we are going inside the teeth. If you get a closer look of the anatomy of the tooth, this is you will find first layer of this is called enamel, and the enamel this is made up of the calcium phosphate and calcium carbonate, and enamel is also harder than the bone because higher content of the calcium. In fact, this enamel is the hardest bone of the body, and this protects the teeth from the acids which can dissolve the dentin. So this is dentin, right? So enamel. I hope you had understood what is enamel. So this is primarily enamel is composed of calcium phosphate and calcium carbonate, and this is the hardest bone of the hardest part of the hardest than any other bone. This is not bone actually. This is the structure tissues is made up of the calcium carbonate and calcium phosphate, right? And if you go inside, further inside, you will find this structure is called dentine, and dentine forms the majority of tooth, because you can see this is a smaller structure compared to the dentine. Dentine is a bigger structure compared to the enamel. So this is the bigger structure, and this is calcified connective tissue, and this gives the basic rigidity which is required by a tooth, and this is also harder from bones. And why? Because it contains a lot of hydroxyapatite apatite chemical, which is responsible for hardness. So inside this dentine, this is enamel, right? Enamel is composed of the calcium phosphate and calcium carbonate. This is dentine, and dentine is composed of the hydroxyapatite chemical. And inside this dentine, you will find this pulp cavity. So inside this pulp cavity, if you get a closer look, you will find a red, these red vessels, and this yellow structure, and this is the blue structure. So these are nothing but they are vessels, blood vessels, and nerve vessels, and lymphatic vessels. So what is the function of the blood vessels? Blood vessels actually brings nourishment to the teeth. And what is the function of the nervous um, nerves? The function of nerve is to provide sensation, because when you eat um, any any hot thing, your teeth become warm. So actually it is because these nerves detect the temperature changes in the teeth. And also if you uh, if you drink any sour thing, it will also detect the temperature changes, right? And the lymphatic vessels, they are also present. Lymphatic vessels and lymphatic vessels produce antibodies and provide protection against any infection. So this root canal or pulp cavity, in pulp cavity has certain roots, and these roots provide the teeth nourishment, sensation, and the protection. All right. So um, this is the cement, and this is also one of the structure would provide strength or support to the dentist, right? So I hope that the problem is clear. And here, if you see, each root canal has an opening, right? Here you will find certain opening, and this opening is called apical forearm. And apical forearm connects these blood vessels, lymphatic vessels, and nerve endings to the nervous system or circulatory system or whatever, right? So okay, so and this was the general introduction to anatomy and physiology um, of the dentist. Now, if something goes wrong, right? So this becomes pathology, and pathology, dentistry is a medical branch which deals with the pathological conditions of the dentist. So endodontics. Anybody know what is endodontics? So there's ecto means outside, endo means inside. So inside dontics means dentist. So inside the dentist, you will means inside the tooth, right? So inside the tooth, you will find this pulp, root, periodontal ligament, and alveolar bulbs. So these alveolar processes, right? So if there is certain inflammation or certain infection, so the prevention and diagnosis and treatment of disorders of the pulp cavity or root canal, this is the branch which deals with it, is called endodontics, right? Okay. So, and this is the uh, outer structure of the teeth. And if you would have seen some of your friends or colleagues which has abnormally aligned teeth. So to correct the or prevent the abnormally aligned teeth, um, the the branch of dentistry which deals with it is called orthodontics, right? And these gums, any treatment surrounding the tissues is called gums, and gums are basically the disease of the gum is dealt by the periodontics, right? I hope this makes sense. All right. So this the root canal procedure is very simple. So if any at the first part, any infectious pathogen attacks on your teeth and go inside your teeth cavity, the pulp cavity, and inside the pulp cavity, you know, there's a lot of nutrition which also obtained by this pathogen, and they actually violate the physiological environment of this teeth, and teeth become starting etching or paining, and then the endodontics doctor or medical practitioner, they extract this root canal nerves and blood vessels from it, and suck through a vessel, and then put a cap on your teeth, so pathogen never come again inside the teeth. So this is the procedure of the root canal therapy, which is very popular um, in the and nowadays. If anybody has any dental problem and in the pulp cavity, people recommend it to go to the doctors. Okay, so this is what the general introduction of the structure and function of the dent of tooth. This is the root canal therapy, and now we are going to study about the general features of the teeth. So if you look at um, dental dentist. So when we are babies, um, we up to age of 12 years, the teeth we have are the number of teeth we have are 20, and these teeth are also called primary teeth or milk teeth or baby teeth. And these teeth, after we are reach at the age of 6, we this babies start erupt the teeth. So in the first 2 months erupt two teeth, and second 2 months erupt two teeth, and the third 2 months erupt 2 months, so two teeth. So this is the primary teeth, and generally they we our body replace these primary teeth with the secondary teeth or permanent teeth at the age of 12 years on average. Okay, so the 12 years. So uh, you will see that our dental formula is 2 plus 1 plus 3 plus 2 plus 1 plus 2 plus 3. So these are the two. This green one is two incisors, and the one, this is the canine, and two, this is the premolars, and three, this is the molars. So 1 2 3 4 5 6 7 8, two molars, incisors, sorry, two incisors, one canine, two premolars, and three molars. So these are totally 1 2 3 4 5 6 7 8. So 8 here and 8 this side. 8 multiplied by 2 is equal to 16, and similarly you will find 16 teeth in your lower jaw. So this is the upper jaw, this is the lower jaw, right? And this is incisors. Incisors, the function of incisors is to cut the food, and the function of the canine is to tear and shed the food, and the function of the premolar and molar is um, to grind and prepare the food for the bolus. So this was all about the dental physiology. I hope you had liked this window. So in last uh, I am Dr. Ayaz Samo. I am running this YouTube channel to teach the human physiology. In this playlist, we are focusing the human digestive system, and today we learnt about the uh, uh, anatomy and physiology of the teeth or our dental cavity, and these lectures are very useful for MBBS students, biological students of biological science, pharmacy, biochemistry, zoology, and I am requesting you to subscribe my channel, like my channel, and please do comment if you have any suggestion to improve my content. These are the references from where we have taken the resource material to teach you. Thank you so much, everybody. Have a good day.